I would like to talk to you about the very important issue of what to do during and after a seizure. There are a lot of myths and misconceptions that surround the care of a patient who is having a seizure. When a patient is having a seizure, one of the first things that many people try to do is to prevent a tongue bite by putting a spoon or something in the mouth to prevent the teeth from hitting the tongue. That is an exercise in futility, because most of the time the tongue bite happens in the first few seconds of a seizure, and putting anything in the mouth can be dangerous because that can go into the lungs and cause a very bad infection, which is called as aspiration. The second thing that many people try to do in order to prevent food contents going into the stomach is to hyperextend the neck like this. That too can result in severe bodily injury. So it would be much better not to do that. The third thing that many people do is to hold the person extremely firmly to the point where putting a lot of pressure. So I've seen people sitting on people's chests to prevent them from moving. This itself can prevent the person from breathing freely and can cause injury rather than being beneficial. All that you need to do during a seizure is to move the patient over to one side and keep the patient away from hard objects, so that if the person vomits, anything that he or she vomits comes out from the mouth rather than going into the lung. After the seizure ends, many people rush to give the patient some water or some food. However well-meaning this may be, the patient is not completely conscious yet. When you try to give a semi-conscious person water or food, that food, instead of going into the stomach, can again go into the lungs. If a seizure lasts for a very long time, or if the person does not show an immediate recovery back to his usual self, it would be much better to take the person to an emergency room so that he can be properly evaluated for any injuries to the head resulting in such problems. Thank you.